When we talk about two of the unique concepts about Nightingale's environmental theory, the first thing that comes to my mind is the way she defines nursing. She defines nursing as an art, and nursing's main goal here is to utilize the patient's environment to assist in his recovery. Another unique factor in her theory is that she believes that the patient, if the nurse sets the right environment, nature itself can heal the patient. So making it the nurse's main job to manipulate the patient's environment to make sure that the patient becomes as healthy as they can be. Some of Nightingale's philosophical assumptions are that nursing is a calling and an art. She basically always said that, you have to want to be a nurse. This is not a job for everyone. Nursing is distinct from medicine. Nursing requires a specific education. Once again, not everybody can be a nurse, and that's why I believe that she always stated that nursing was a calling and an art, and that people can control their outcome of their lives and therefore pursue a perfect health. Additional assumptions that can be extracted from Nightingale's work include maintaining a clean room, bedding, and clothes aids in a patient's recovery. Noise can be harmful to patients, and managing the environment improves the health of the patient. The propositions in Nightingale's theory are the first one: the nurse's role is to prevent the reparative process from being interrupted. So once again, the nurse is to arrange the environment and manipulate the environment to help the patient in nature, basically to let nature do its thing. That's basically her other proposition, that the person or the recipient of the care will cooperate with the nurse, the environment, in order for that process to get started. When it comes to the limitations in Nightingale's environmental theory, the main thing that comes to mind is that you can only manipulate the environment for so long. Providing healthy environmental conditions will help the patient, but it can only go so far when it comes to treating the disease and the illness. Her theory also says little about the application of medical technology. Now, granted, during that time, the technology was limited, but I will assume that there was some technology available.